Okay, this is the Valgus stress test. It tests the MCL. And then the first thing I'm going to do is have the patient lay down, okay, and then scoot towards me just about an inch. Good, because I need to have good patient control here. For the demonstration, I'm going to pull his shorts up just a little bit. So this is the structure right here on the medial joint line, this MCL that we're going to test. Okay. The Valgus stress test involves applying a valgus force. We were just talking about genu valgum, in which the femur was angling in. So our force is going to go from lateral to medial. That's a valgus force, and the varus force goes the other way. Okay. Now, I need you to move over this way, because I'm going to hold his femur with my one hand, and I'm going to, actually that's a lot, I'm going to hold in the joint line, which is trying to control the femur, and I'm going to control the tibia with my left hand. Okay, can everybody see me? All right, so your job is just to relax. Got it? Okay. Now, I can feel that he's locked out, and if he had any hyperextension, he would be resting in hyperextension. So what I'm going to do is pull him slightly, just loosen him up a little bit, right there. Okay? So it's still basically fully extended. I'm just not having him in a locked out position, right there. Okay? Now, what I notice is that as soon as I do that, and you're going to try to let me control this limb, it's a little bit better. See? Give him a little bounce so that you're in control. And do you see how he's doing a little bit of external rotation? That ain't it. Okay, there. All right. Relax. Ready? So, you gotta relax. That's better. That's a lot better. I know you're trying to watch because you want to see how this goes. I promise I'll show it to you in a minute. My hand in the joint line, okay, is pushing straight this way, and with my hand down here, I'm actually pulling the tibia, kind of like abducting it. So 1, 2, 3. Okay, and then I'm going to put him in about 20 degrees of flexion, and I'm going to do the same thing. Okay, see, I'm giving about 1, 2, 3. I can feel there's a little tiny bit more laxity in 20 degrees than in 0. Okay. The test is done in 0 because it tests this aspect of the joint capsule as well as the MCL, and we're going to isolate the MCL by doing the test at about 20 degrees. Good. Okay. If Colton really had a knee injury, that's a pretty good test right there. And he was in a lot of pain. He's probably going to have some good muscle guarding going on. Muscle guarding, muscle spasm will ruin a ligamentous special test. You will get what we would call a false negative. You will not be able to get any movement in there even though the structure is actually injured. Okay. All right, so that's the valgus test. To do the varus test on the same leg, come around over here, I'm going to go ahead and sit down and prop his leg up on me because I now have to push from medial to lateral. Okay? So wrap your arm around like this so that you got good control of the leg. You relax. Okay, good. And still with this hand, this is the job of this hand to support the femur and give the force in the medial joint line right here. Okay. You don't want him locked out. Right there's fine. Okay. Now notice what happened. It looked like, for one thing, a little bit. Yeah. Every time I push, doesn't it look like he's going to go into external rotation? Mm-hmm. This is going to be your challenge. You've got to be able to get that force through the joint there in a way that does not rotate. That's an excess motion that you don't want. And again, we're doing it at 0, and do it about 20. Relax the best you can. Good. Okay. So there it is at 20. Varus and valgus test. Okay, let's turn that up.